Every single day, 800 million people around the world wake up with back pain. They reach for the ibuprofen on the nightstand before their feet even touch the floor. They move carefully, like they're made of glass. They cancel plans, skip workouts, and sit hunched over their desk, wondering when the pain is finally going to stop. And here is what no one is telling you at your appointment. In the vast majority of cases, your spine is completely fine. The discs are fine. The vertebrae are fine. The MRI your doctor ordered? It is showing you things that look scary on film, but have absolutely nothing to do with why your back hurts. The back pain industry is worth over $100 billion a year. Injections, surgeries, specialist visits, pain management clinics, memory foam mattresses, ergonomic chairs, lumbar support pillows. And yet the rates of chronic back pain keep rising every single year. If the treatments were working, that number would be going down. It isn't. Because most of the time, the treatments are aimed at the wrong place entirely. I'm Dr. Jon Chester, and I've spent 15 years watching people suffer through completely preventable back pain while being told to rest more, lift less, and take stronger pills. Subscribe to this channel and hit the like button right now. We're building toward 1,000 subscribers on one simple principle. The system profits when you stay in pain, not when you recover. What I'm about to tell you, nobody in a clinic has the time or the incentive to explain. Let's start with a story. The alarm goes off at 6:30. You roll over to grab your phone and feel it. That sharp, grinding tightness across your lower back. You lie still for a second, hoping it passes. It doesn't. You sit up slowly, hands pressing into the mattress, and you make that sound. You know the one. The involuntary grunt that means today is going to be one of those days. By the time you've made it to the kitchen, you're already compensating, leaning slightly to one side, holding your coffee mug a little lower, sitting down with the kind of careful, controlled descent that makes you feel 30 years older than you are. You've been here before. This is the third time this month. The first time it happened, you thought you'd just slept wrong. The second time, you figured it was the long car ride. Now you're starting to wonder if something is actually wrong with your spine. So you go to the doctor. The doctor presses on your back in a few spots, watches you bend forward and back, and sends you for an MRI. The MRI comes back showing a bulging disc at L4, L5. The doctor points to it on the screen like it's the smoking gun. There's your problem, they say. The disc is pressing on the nerve. They give you a prescription for muscle relaxants and anti-inflammatories and tell you to avoid heavy lifting and come back in 6 weeks. 6 weeks later, you're still in pain. Here is the truth about that MRI finding. Studies have consistently shown that bulging discs, disc degeneration, and even herniated discs show up on MRIs of people who have zero back pain whatsoever. In one landmark study, researchers scanned the spines of people who had never had a single episode of back pain. More than half of them showed disc bulges. More than a third showed disc degeneration. These were completely pain-free people. The MRI finding is often just a normal part of aging, like gray hair or wrinkles. It is not automatically the cause of your pain. So what is actually causing the pain? The answer is going to change how you think about your body entirely. Your back is not a fragile structure. It is not a stack of glass plates that can shatter if you move wrong. It is an extraordinarily engineered system of bones, muscles, fascia, tendons, and nerves that has been carrying humans through physical labor for hundreds of thousands of years. The spine itself is remarkably resilient. It is designed to bend, twist, compress, and extend over and over again for an entire lifetime. The problem is not the spine. The problem is what surrounds it. Let me explain this with a simple analogy. Imagine a tent. The vertical pole in the center of the tent is your spine. The tent stays upright not because the pole is rigid and immovable, but because of the ropes anchored to the ground on all sides, pulling in balance. Those ropes are your muscles. When the ropes on one side are too tight and the ropes on the other side are too loose, the pole doesn't stand straight. It bends. It wobbles. The tent starts to collapse. Your spine works exactly the same way. When the muscles surrounding it are balanced and functioning properly, the spine sits perfectly aligned with almost no pressure on any individual disc or joint. But when those muscles become imbalanced, when some are chronically tight and some are chronically weak, the spine gets pulled out of position. Joints compress where they shouldn't. Nerves get irritated. Discs bulge slightly because the load is no longer distributed evenly. And you feel that as pain. This is called muscular imbalance, and it is the true cause of back pain in the overwhelming majority of people who don't have a traumatic injury. Now, I need to say something important before we go further. There are certain symptoms that should send you directly to a doctor or an emergency room, not to a YouTube video. Understand these first. If you have back pain combined with loss of bladder or bowel control, this is a medical emergency. Something may be pressing on the nerves that control those functions, and if left untreated, the damage can become permanent. Go to the emergency room immediately. If you have back pain accompanied by severe weakness or numbness that runs down your leg and into your foot, particularly if you are losing the ability to lift your foot off the ground when you walk, that is called foot drop, and it signals significant nerve compression that needs immediate evaluation. If your back pain is constant, does not change with position, and is worse at night while lying down rather than during the day, that pattern can be a warning sign for more serious pathology, including certain types of cancer that spread to the spine. Combined with unexplained weight loss, that needs urgent investigation. If none of those apply to you, breathe. Your back pain is most likely mechanical, meaning it is about how your muscles and joints are functioning, not about structural damage. And mechanical pain is reversible. Let me now introduce you to a patient. I'll call her Priya. She's 41 years old, a software project manager who works from home. Bright, organized, completely frustrated. She walked into my practice having already seen 2 physiotherapists, a chiropractor, and a pain management specialist. She had been told different things by each of them. One said her core was weak. One said her hips were tight. One said her posture was poor. All of them were partially right, which is to say, none of them gave her the full picture. Priya's pain was in the classic location, the lower left side of her back, radiating slightly into her left buttock. It was worst in the morning and after sitting for long periods. When she stood up from her desk, she'd have to hold on to the edge of the table for a moment before she could fully straighten. When I watched how she moved, the problem became immediately obvious. Not from any fancy imaging, just from watching her walk, sit down, stand up, and bend forward. Her hips were not moving correctly. When she bent forward to touch her toes, instead of hinging at the hips, she was rounding from the lower spine. All the movement was coming from her lumbar vertebrae. Her hips were essentially locked in place. When she walked, her pelvis was tilted forward. You could see it clearly, an exaggerated arch in her lower back, the kind that looks like someone is perpetually sticking their backside out. In medicine, we call this anterior pelvic tilt, and it is extraordinarily common in people who sit for long stretches of the day. Here is exactly what was happening in Priya's body. She was spending 8 to 10 hours a day sitting at a desk. In a seated position, the hip flexors, the muscles that run from the front of your thigh up into your lower back and pelvis, are in a shortened position for hours at a time. Day after day of this shortens them permanently. They become tight and overactive. At the same time, the opposite muscles, the glutes, the large muscle group in your buttocks, which are responsible for extending the hip and stabilizing the pelvis from behind, become underactive. They switch off. In clinical terms, we call this gluteal amnesia. The glutes literally forget how to fire properly because they are not being used. The result is a pelvis that is constantly being pulled forward at the front by the tight hip flexors, with nothing strong enough at the back to counterbalance. This tips the pelvis into that forward tilt, and when the pelvis tilts forward, the lower lumbar spine is forced into excessive extension. The curve in your lower back becomes exaggerated, and the facet joints at the back of the vertebrae get compressed together. That compression creates exactly the kind of grinding, aching lower back pain that Priya, and probably you, are experiencing. But here's the part that truly shocked her. Her back muscles themselves were not weak. In fact, they were overworked. They were working overtime to stabilize a pelvis that should have been stabilized by the glutes. They were compensating for dormant muscles, and they were exhausted. When you treat that kind of back pain with back exercises alone, You are adding more work to muscles that are already doing too much. It is like trying to solve a problem of overworked employees by giving them even more tasks. The real solution has two parts. You have to release the tight muscles that are pulling the pelvis forward, and you have to reawaken the muscles that have gone to sleep. And that brings us to the one thing I want you to do immediately. Not tomorrow, not after you finish watching this. Right now, if you can. Stand up. Place your feet hip-width apart. Soften your knees slightly, don't lock them. Now, tighten your abdominal muscles gently, just 10 to 15% of maximum effort. Not bracing hard, just lightly engaged. Now tuck your tailbone very slightly downward, as if you're trying to reduce the curve in your lower back. Your pelvis should feel like it's rotating backward, very gently, by just a few degrees. Not bracing. Now, squeeze your glutes, not violently, just firm and deliberate. Hold that position for 5 seconds. Release. Do that 10 times. That is a posterior pelvic tilt exercise combined with glute activation. It sounds almost insultingly simple, but what you just did is directly counteract the primary mechanical dysfunction driving the majority of lower back pain cases. You just used your glutes to pull the pelvis back into alignment, releasing the compression on the facet joints and reducing the strain on the overworked back muscles. Do not underestimate this because it felt easy. The significance is not in the difficulty of the movement. The significance is in what it wakes up and what it teaches your brain. Because here is the deeper problem. It is not just that Priya's glutes were weak. It is that her nervous system had, over years of sitting, essentially stopped including them in the movement patterns she used every day. When she reached down to pick something up, her brain was not sending a strong signal to the glutes to help. It was defaulting to the lower back. When she climbed stairs, same thing. Back and hamstrings doing the work that should be split evenly with the glutes. This is called a motor control problem, and fixing it requires repetition and consistency, not just one stretch or one exercise. It requires reteaching the nervous system to use the right muscles in the right sequence. Now let me give you the full picture of what a proper recovery protocol looks like. 3 parts: morning, throughout the day, and evening. Exactly the same structure as the golden protocol I give every patient who walks into my practice. Part 1, the morning reset. Before you stand up from bed, before you scroll your phone, before you do anything else, do this. Lie flat on your back. Bend both knees so your feet are flat on the mattress. Gently press your lower back into the mattress, flattening that lumbar curve. Hold for 3 seconds. Relax. Repeat 10 times. This is called a supine pelvic tilt. It costs you 90 seconds. It lubricates the lumbar joints with synovial fluid, signals the deep, stabilizing muscles of the spine to wake up, and begins the day with your pelvis in a neutral position, rather than the anteriorly tilted position it may have drifted into during the night. After the pelvic tilts, do a hip flexor stretch before you stand up. Still lying on your back, pull one knee toward your chest and hold it firmly with both hands. Let the other leg extend flat on the mattress. Hold for 30 seconds. Switch sides. You are stretching the shortened hip flexors that have been compressing your lumbar spine. Do not rush this. 30 seconds per side, minimum. Part 2, the daytime protocol. If you work at a desk, this section will change your life more than anything else. Here is the single most important rule. Your body is not designed to stay in any one position for more than 30 to 40 minutes at a time. Not standing, not sitting, not walking. Movement is the mechanism by which your spinal discs receive nutrients. They have no blood supply of their own. They are fed by a process called imbibition, which means they absorb nutrients from the fluid around them when pressure is applied and released rhythmically through movement. A disc that sits stationary under constant load for hours is a disc that is starving. Set a timer on your phone. Every 30 minutes, you stand up. Not to go anywhere necessarily, just stand. Roll your hips forward and back a few times, take 5 deep breaths, and sit back down. That's it. 30 seconds of movement every 30 minutes. The difference in how your back feels by the end of the day will be remarkable within a week. The second daytime rule. When you sit, be intentional about your foot position. A common contributor to anterior pelvic tilt while sitting is letting the legs drift wide or crossing them habitually. Place your feet flat on the floor, hips and knees at roughly 90 degrees. This keeps the pelvis in a more neutral position and reduces the chronic pull on the hip flexors. Third, if you carry a bag, alternate shoulders every single day. The habit of always carrying weight on one side is one of the most underestimated contributors to chronic lower back asymmetry. One side of the body learns to hike the shoulder and tilt the pelvis to compensate, and those asymmetries become baked in over years. Part 3. The evening work. This is where you actually reverse the damage accumulation of the day and build toward genuine recovery. Step 1. The couch stretch. Kneel on a mat or a folded blanket. Place your right knee on the ground and step your left foot forward so you're in a half-kneeling position. Now tuck your tailbone under and squeeze your right glute. Lean your torso very slightly back. You should feel a deep, significant stretch in the front of your right hip, running from the thigh up toward your abdomen. Hold this for 60 seconds. Switch sides. This is the most effective hip flexor stretch available for the kind of tightness that drives anterior pelvic tilt. It stretches the psoas, the deepest hip flexor, which runs from the inner thigh all the way up to the lumbar vertebrae. A tight psoas is one of the most direct mechanical causes of lower back pain, and most stretches do not reach it effectively. The couch stretch does. Step 2. The glute bridge. Lie on your back. Knees bent, feet flat on the floor, about hip width apart. Squeeze your glutes hard and push your hips toward the ceiling. Hold at the top for 3 seconds. Lower down slowly. The lowering phase matters as much as the lifting phase. Do 15 repetitions, 3 sets if you can. This exercise directly targets the gluteus maximus and gluteus medius, the muscles most responsible for pelvic stability. Every repetition is a lesson to your nervous system. Use the glutes. Include them. Remember them. Step 3. The dead bug. Lie on your back. Bring both arms straight up toward the ceiling. Bend both knees to 90 degrees with your shins parallel to the floor, like a tabletop with your legs. Gently press your lower back into the floor, using that pelvic tilt we practiced in the morning. Now slowly lower your right arm behind your head, while simultaneously extending your left leg toward the floor. Keep your lower back completely flat. Do not allow it to arch. Return to start. Switch sides. 10 repetitions per side. This exercise trains the deep, stabilizing muscles of the spine, specifically the transversus abdominis and the multifidus, to maintain spinal position while the limbs are moving. This is the real definition of core stability, not six-pack muscles, not planks for endurance. The ability to keep the spine neutral while your arms and legs do work. That is the function your spine needs every time you pick something up, reach for something, or rotate your torso. Now, back to Priya. She looked at this protocol with the polite skepticism of someone who has already tried many things. She had expected an injection. She had expected a specialist referral. She had not expected to be told to lie on her floor for 15 minutes in the evening and squeeze her backside. She came back 3 weeks later. She had done the protocol consistently. Not perfectly, she admitted. She'd missed a few days, but mostly she'd done it. She sat down across from me without holding the chair. She stood up without that pause where she used to grip the desk. She said the morning stiffness was almost gone. The ache while sitting had reduced by about 70%. And the most surprising thing, her energy was better. Because she wasn't spending mental and physical resources all day compensating for a dysfunctional movement pattern. She asked me, why didn't any of the other practitioners tell me this? It is a fair question. The honest answer is that it takes time to explain. It requires understanding the biomechanics, not just the anatomy. It does not involve a billable procedure. And in a healthcare system that rewards intervention over education, the incentive to spend 45 minutes explaining pelvic mechanics to a patient simply does not exist. That is what this channel is for. Let me leave you with your immediate action plan. 5 steps starting tonight. Step 1. The standing test. Stand naturally and look at yourself sideways in a mirror. Is your lower back arched significantly? Does your belly push forward and your backside push back, even when you're trying to stand upright? If yes, you have anterior pelvic tilt. That is your primary target. Step 2. Right now, do 10 posterior pelvic tilts standing up. Feet hip width, soft knees, gently tuck the tailbone, and squeeze the glutes. Hold 5 seconds each. That is your immediate intervention, starting this moment. Step 3. Set a phone alarm labeled "Stand Up" to go off every 30 minutes during your workday tomorrow. Do not negotiate with it. Stand up every time. Step 4. Tonight, before bed, do 1 set of the couch stretch and 1 set of glute bridges. Just 1 set, just to begin. Step 5. Lie on your back and do the morning pelvic tilts described earlier. Do them tomorrow morning before you stand up. Start the day by communicating with your spine correctly. If you do only these 5 things consistently for 2 weeks, you will be shocked at the difference. Not because of magic, because you will finally be addressing the actual cause of your pain, instead of managing the symptoms of a fire while the real problem burns in another room entirely. One last thing I want to address, because I know someone is thinking it. What about posture? What about the mattress? What about lifting mechanics? All of those things matter, yes. Poor lifting mechanics can trigger an episode of pain. A very old mattress that sags can worsen overnight symptoms. Forward head posture from staring at a phone screen contributes to upper back tension that can refer down. I will cover all of those in future videos, but none of them are the foundation. The foundation is always the muscular balance around the pelvis and spine. Fix that first, and everything else becomes easier to address. Leave that broken, and no amount of ergonomic equipment or lifting technique will keep the pain away permanently. Your back is not crumbling. It is not degenerating. It is not a ticking time bomb. It is a highly capable structure that has been let down by the lifestyle we built around it. Chairs and desks and cars and couches that keep us stationary, passive, and tilted in exactly the wrong direction for 10 to 14 hours a day. The answer to that is not surgery. It is not injections. It is not indefinite anti-inflammatory medication. The answer is movement that is specific, targeted, and consistent. Teaching the right muscles to do their jobs again so the spine can finally stop doing everyone else's job for them. That is not complicated. It is just rarely explained clearly. Subscribe to Dr. Waterling, hit the like button, and help us reach 1,000 subscribers. Because every person who watches this video is one less person who ends up spending years in unnecessary pain while the system tells them their spine is broken. Your spine isn't broken. You just need to give it the right support. I'll see you in the next one.